Fever, it's like a nightmare to all the parents. Whenever baby has fever, everybody gets very scared. Fever aa gaya, 100, 101, 102. See, fever is just a reaction of your body to a foreign, antigen. Foreign antigen means a virus or a bacteria that comes from outside, and it enters our body, and our body start fighting it. So
Yeah.
it gives a reaction, and grade of fever doesn't make a difference. That really doesn't make a difference. It's just how your baby is fighting that infection.
Right.
So fevers, most of fevers are viral fevers. However, a few of them can be bacterial, and we have to find out that is it viral or is bacterial. So in a day or two, I cannot tell you. You have to have a lot of experience. So you have to go to a pediatrician, whosoever is nearby, to find out this is a viral fever. No, but I can give you a few examples. Mostly those, if more than a couple of members of your family are sick, especially everybody in your family has runny nose and cough, usually they are viral fevers. If your
Right.
child is otherwise active and having mild fever, and even a fever of 100, 102, and otherwise the baby is active and the fever goes with paracetamol, it's usually going to be a viral fever. If
Right.
your fever is prolonged and the child is dull, the child is not feeding well, or if the child had some respiratory problem, then it can be something different. It can
Right.
be a typhoid, it can be a viral, it can be a pneumonia. That is a time you should definitely go to a pediatrician or a doctor nearby. But
Right.
height of fever doesn't make a difference. And mostly I'll say safe medications are paracetamol. Sometimes we have a habit of using Meftal P or Ibugesic Plus. I'll not say they're very harmful, but especially in dengue time, we should not be using it, because when the baby have dengue, there's an increased risk of bleeding. That time using all those strong medication might cause bleeding once in a blue moon. So we don't take that place. So if you are self-prescribing without seeing a doctor, then don't give anything about more than paracetamol. Paracetamol means crocin, Calpol, Dolo. Yes, you can give those medicine yourself, and then at midnight, if the baby has fever, you can give that medicine again. That decreases the discomfort of the baby, and you can always come to a casualty or an emergency or a doctor's OPD where you want to go. So
Right.
fever is a reaction. All fevers are not dangerous. In fact, most of fevers are not dangerous, and most of fever go themselves without medication, like in couple of days. So I hardly use any medication for fever apart from Crocin.